name's Megan. I've been a nurse for a little over 5 years now. I've worked at the same hospital those entire 5 years. I do have my RN, my BSN, my PCCN certification, and then I also have my Clinical Ladder 3, which is a program we do at the hospital I work at to incentivize nurses to continue their education. So I get to work. My shift starts at 7 a.m. and my shift is over at 7:30 p.m. As soon as I get to work, we start the day off in what we call a huddle with all the nurses on the floor and the charge nurse, and we talk about the sickest patients on the floor, if there's any updates, any big events that we need to know throughout the day, and kind of what staffing looks like for the day. After we finish huddle, that lasts maybe about 2 to 3 minutes, and I will go find my patients for the day. Typically, I'll sit down at a computer and wait for the nurse that's leaving shift to find me, or I'll go find them. And with my job now, I have 1 to 2 patients in the ICU where I work, which is really nice, so I can really focus all my attention on those patients. But I will talk to the previous night shift nurse. I'll get a report from her. We'll go meet the patient together, make sure there isn't any big changes with their neuro status or with their vital signs at shift change. Then I'll go to the computer and I'll kind of look at what my 12 hours is going to look like. After I read up on their notes, double check my orders, I make sure there's not any labs that I need to collect, and then I'll go see my patient. I'll begin their medication pass for the morning. I'll do my assessments, try to make sure they're all tidied up and complete, and make sure there's not anything acute happening that I need to notify the provider. And then around 9 o'clock, I run with the providers. I present the patient to them. I talk about any changes overnight, anything that I need from them for the patient, and we talk about what the plan of care is for the day moving forward. After I round with the team, usually I'll sit down and chart for a couple of minutes, and then if there's any new orders or new scans that I need to complete, I'll try to coordinate all of that. And then throughout the day, I just pretty much check on my patients every hour, report any changes to the providers, and sometimes things can change and happen very fast, or sometimes my day might be a little more status quo and I just finish their meds for the day and then repeat the process. So the first 2 to 3 hours of my shift, I would say, are the busiest, where I'm trying to get my patients settled, everyone's nice and clean, what's going on for the day, their medications are done, all of their needs are met from me. And then on top of that, all of their assessments are charted. I have to make sure their family's updated. Is their family in the room with them? Do I need to touch base and talk about the plan of care? If their family's not there, do I need to call them or touch base with the provider about somebody calling and updating the family? A lot of people don't really understand what the nurse does at the bedside, you know? A lot of people just think the nurse is there to give the patient the medications and clean them up or to help feed them, and those are all really important things I do in my job and I really take pride in. But I'm also notifying the provider anytime there's a change. I'm notifying the provider if a medication isn't working. I'm suggesting what other kind of medications would maybe be good in this situation. I'm notifying them about any kind of mental status change, coordinating all the plan of care when it comes to getting this patient to a scan they might need or a procedure they might need. I'm also recovering the patient once they come out of surgery. I'm notifying the family. So there's a lot more that goes into it than just giving patients their medications. Something that I've learned over the last 5 years is to have patience, and I've definitely learned that from my patients. Sometimes as nurses, we want to start our day and we have a plan for everything that we have throughout the day, all the things that I need to get done, all of my tasks. I know specifically at what time I want to get something done, and then it usually never happens that way. So you just have to learn to have patience and take things at your patient's speed, I would say. And then sometimes they have to have patience with us too, because we're doing things to save their life sometimes, and they might not want to do it, but it's what we have to do. I want to make sure I'm being proactive and updating the family and making sure their needs are met too, because I'm not only taking care of my patient, but I'm also taking care of their family and making sure they feel reassured and they trust us about what's going on with their loved one. I have a lot of patients actually that I feel like I'll never forget, and they've maybe touched my heart, or maybe I've touched their heart in a really special way, but one patient I truly will never forget, unfortunately, is no longer with us on this earth. but I care immensely about this patient and their family member, and I'm so grateful that I was able to be a nurse for this patient. I knew this patient for all 5 years of my career. She had almost the same birthday as me. We would always joke every year about how we were birthday twins, and unfortunately over the last 5 years she just progressively kept getting worse. She had a chronic illness, so not something we could necessarily fix unless we gave her completely new organs, which she was on the list for. But within the last 6 months, she really took a turn and unfortunately couldn't handle the intense requirement that organ donation is, and getting new organs is very, very hard on the body, and unfortunately she was just too sick at this point. So she recently passed away, and a lot of the nurses that I worked with over the last 5 years, we all went to her funeral together. So it was closure for her family, and then for us to know we took the best care of her we possibly could. And I know it meant a lot to her family too, that we were all able to go and support her one last time. I would like people to know that most nurses out there have a lot of compassion for what they're doing. They love taking care of their patients. They love helping people. So even though it might come off as cold, really, I think the majority of nurses have really good intentions, and all that we want to do is help you. Being a nurse has really opened my eyes to a whole other side of the community that we live in. I really feel like there's a lot of privilege that I have. I might not be rich, I might not have everything that I want, but I still have a roof over my head. And I feel like a lot of people can't say those same things, and a lot of people don't have access to food, or maybe access to healthy food at least. So when I see these patients come in and we wonder, oh, why didn't you take care of yourself and give yourself insulin? It might not be because, you know, maybe they can't afford it. So it's really just opened my eyes to a lot of issues that we have in our society, and I hope one day that we can change that.